Here's more practice on Select All That Apply. The nurse is planning to do preoperative teaching for a client and a family member, both of whom speak and understand primarily Spanish and have limited abilities using other languages. What activities would promote learning for the client and family? Select all that apply. Letter A, teach the client and the family member separately. B, provide detailed information. C, ensure the room is quiet. D, before the end of the session, ask the client if he or she has questions. E, listen to any concerns the client may have. And E, provide verbal instructions and printed materials in Spanish. Okay, we'll give you a minute for this one, and then we'll come back and talk about the correct answer and why the other answer choices are not correct. Okay, let's come back to this question. The correct answers are C, D, E, and F. Okay, C, D, E, and F. So what you're looking for here is you're planning your preoperative teaching. And the reason nurses conduct teaching before preoperative, before surgery, is because if your client is, after your client has had the surgery, they may be in pain, they may be sleepy from the pain medication or the anesthesia. They are not listening, they are not comprehending, and they are not taking in that information, that very important information that they need to know after their surgery. So that is why we conduct, as nurses, pre-operative teaching. Okay, so you're planning to do your pre-op teaching for a client and a family. They have the primary language of Spanish and have limited abilities using other languages. So we're looking for here the positive answers. Which one of these activities would promote learning for the client and family? Okay, so which one of these would help the client and family to understand the material the best? Okay, I said that the answers were C, D, E, and F. So let's look at the other ones that are not correct. Okay, so letter A, teach the client and family members separately. No, you don't have to teach them separately. You can teach the family members and the client together. And letter B, provide detailed information. So the nurse should not provide information that's too detailed. Okay. Letter C is correct. Ensure the room is quiet. If the room is noisy, you may even, if they have the TV on a little bit loud, you may even ask them to turn the TV down or turn it off. You might, if this is an older client, you might want to make sure they have their hearing aids, glasses, things like that that are important for them to hear you and see you and understand what you're teaching them. This is very important patient education that you're providing. Letter D, before the end of the session, ask the client if he or she has questions. Yes, you want to do that. Okay, you want to ask even at the end of the session, you can ask the client or family if they have questions. Letter E, listen to any concerns they have. Yes, you definitely want to listen to their concerns. F, provide verbal instructions and printed materials in Spanish. Yes, definitely you would do that. Verbal and printed materials in Spanish so that they can take the printed materials home. If they forget something, they can look back on it after they get home. Because you know when you're in front of the doctor or the nurse, You never think of all the questions that you have. Once you get home, you think of other questions, and there you have the printed material that they can look back on. Okay, so that was C, D, E, and F are the correct answers on that one that will promote learning for the client and family who have limited language in English. Okay, and so look out for the next one. Have a great day. This is Dr. Hart, Nursing with Hart. Have a good one.